Have you ever heard of gynecomastia? Because that's what today's video is about, so watch it all the way to the end. We'll tell you everything you need to know about it. Gynecomastia is the medical term for the enlargement of the mammary glands in men, and is also known as man boobs or bitch tits, which can affect men at any age and has a variety of different causes. Possible causes of gynecomastia are, for example, various medications such as ACE inhibitors and antidepressants, but also diseases such as chronic liver or kidney insufficiency and obesity. Furthermore, certain drugs can also lead to gynecomastia because of a reduced testosterone level in combination with an increased estrogen level. By the way, such an increased estrogen level can also occur if certain foods such as beer or meat with a high estrogen content are consumed often. Additionally, gynecomastia is one of the most common side effects of anabolic steroids in bodybuilding and other sports. Both men and women have testosterone, the male sex hormone, and estrogen, the female sex hormone, in their blood. In men, however, it is usually more testosterone, while in women, it is more estrogen. In men, estrogen is produced by the enzyme aromatase from androgens, which also include testosterone. So if you take in too much testosterone through artificial steroids, you will end up with more estrogen in your blood than a man should have. And this can create a discrepancy between the androgenic and estrogenic effects in the mammary gland tissue, because androgens, like testosterone, inhibit mammary gland growth in men, while estrogens promote it. Naturally, when taking anabolic steroids, both testosterone and estrogen increase in the blood. So with many steroid users, the ratio remains at a level that makes gynecomastia unlikely. But every body reacts differently, and especially at very high doses. It has actually been proven that a high estrogen level can trigger gynecomastia despite a high testosterone level. So you can already significantly reduce your risk of gynecomastia by not taking certain medications, avoiding obesity, and generally living a healthy lifestyle without a lot of alcohol or low-quality meat. You should also abstain from steroids, of course. If you absolutely want to take steroids, however, then at least take them in the smallest possible doses. But even then, it is highly recommended that you have your blood taken by your doctor sometimes to check your estrogen levels. After all, you want to look good and not get man boobs. However, we think that you should generally avoid steroids unless you earn a lot of money as a professional bodybuilder, Hollywood actor, or fitness influencer. And in that case, you should certainly know a lot about steroids. After all, it's your health that's at stake here. But what can you do if you already have bitch tits? It's quite simple. In mild cases, a simple change in your diet or a treatment with medication through your doctor can already solve the problem. If the gynecomastia is already more advanced, however, surgical removal of the excess breast tissue is by far the most effective way to get rid of it in the long term. But it's best, of course, to not let it get that far away. We certainly wish you always good health and that you achieve all your fitness goals in the future. That's it again for today. If you liked the video, share it with your friends.